understanding what OCD is all about. OCD can manifest itself as quirky behavior, exaggerated fears, or seriously disturbed thinking. You may be surprised to know that everyone occasionally has a few signs of OCD, obsessive compulsive disorder, and some symptoms of OCD are perfectly normal. Just because you have one or more symptoms of OCD does not mean that you have the disorder. OCD has two components: obsessions and compulsions. First, obsessions and compulsions are detailed and differentiated. We will later discuss in another video how people with OCD cycle through obsessions, worry, and compulsions. The OCD brain can come up with wild thoughts and strange actions. There are two sides of OCD. Almost everyone with OCD has both obsessions and compulsions. The difference between an obsession and a compulsion is that obsessions are intrusive mental events that make a person feel upset. Compulsions, on the other hand, are behaviors or actions that someone engages in either mentally, like counting or repeating words, or physically, like washing hands, in order to feel better. Obsessions start in the mind and then create a negative emotional response, while compulsions are actions, either mental or physical, targeted to soothe negative emotions. Obsessing about obsessions. Obsessions are like uninvited house guests or friends who refuse to leave. They barge into your mind like mental terrorists. Obsessions make you feel uncomfortable, angry, sometimes frightened. These are normal feelings for human subjects. Obsessions come in three forms. Thoughts. Thoughts are the words that clang around in your head. For example, if you touch something dirty, you may have the thought, "I'm sure to get sick if I do not do something immediately." Other obsessional thoughts come into the form of doubting whether you have locked doors or concerns about things not being arranged correctly. Urges. These are feelings, impulses, or worries that you're going to do something inappropriate or undesirable. For example, you may have an urge to harm someone that you care about, or a need to have everything in a specific just so or just right order. Other examples of obsessive urges include worries that you may shout out obscenities during a religious ceremony, or that you may turn your car into oncoming traffic. Images. These are uninvited pictures that form in your mind, often depicting violent, horrifying, morally apprehensible or reprehensible, weird, and unwanted scenes. Disturbing images may include scenes involving inappropriate sexual activities, child abuse, or gruesome murder. Obsessive thoughts, urges, or images pop into the mind randomly. When they do appear, they cause a lot of distress if you have obsessive compulsive disorder. Experienced intrusive, unwanted thoughts, impulses, and images. These are obsessions. These are not pleasant daydreams. People don't willfully ask for obsessions. And so therefore, people associate with their obsessions and they are disconnected. The thoughts are unwanted and unacceptable to the person who has them. Again, associates with their obsessions are unacceptable. When an obsession comes along, it is difficult to think about anything else. They interfere with whatever a person was trying to think about or get done, and therefore they associate with their obsession and are uncontrollable. Worry, guilt, fear, anger, disgust, or sadness often follow obsessions. Associates with their obsessions are highly upsetting. And of course, their obsessions can be frequently reoccurring. An obsession tends to reoccur often. The informal use of the word obsession often conveys a positive, enthusiastic focus on something pleasant or desirable, such as a passion. For example, it could be a passion or a hobby or an activity that one does for pleasure. Considering compulsions, compulsions are actions that people feel driven to complete in order to deal with obsessions. These actions take the form of behaviors, such as rituals. Obsessions heighten anxiety, and compulsions are intended to neutralize the obsessions or reduce distress. Compulsions can also come in the form of mental acts. Compulsions are attempts to reduce anxiety, to respond to an urge, to decrease discomfort, to seek certainty, often feeling compelled to return to check again to be absolutely certain, and obtain reassurance. The feeling of wanting to be, or compulsion to repeat this ritual many times, seeking this reassurance. And before they stop, for example, the parents become upset and irritated, but they always give them the reassurance that they ask for. For example, there could be an increase in sense of safety or well-being. Someone may have frequent obsessional worries that their thoughts might cause harm. Obsessions and compulsions can vary in both intensity, duration, and content over time. For decades, obsessive compulsive disorder used to be considered as one of the anxiety disorders. However, OCD involves more than anxiety. It also includes distorted thinking as well as repetitious urges and impulses. More recent diagnostic categories list OCD and related disorders separately from anxiety disorders, and indeed, obsessive compulsive disorder is a personality disorder. An obsessive thought, urge, or image occurs. Their logical mind is overwhelmed with uneasiness. They give in to the impulse. They are temporarily relieved. They cannot tolerate not being sure. Unfortunately, completing the compulsion results in only a short period of relief, which in turn actually increases the likelihood that the compulsion will be turned to again. They have done enough cleaning, for example, after the contamination type of OCD or subtype. Many have done enough cleaning for the day but still feel greatly relieved, but only for a short while, and then they're on to cleaning again. Obsession leads to anxiety. Rituals reduce anxiety, however, thoughts keep coming back. This worry cycle is a continuous loop. Obsessions are interrupted as serious dangers, which lead to anxiety and a compulsion to do something to reduce the risk in order to alleviate the anxiety. OCD is complicated, and the symptoms often involve more than anxiety. People with OCD have problems with the way they think and with their ability to control urges and impulses. Thinking and believing. OCD is a disorder of belief or thinking. People with OCD lack complete insight into their obsessions or compulsions normally. They may admit that their obsessions or compulsions are unreasonable, but they do not fully believe that the obsessions or compulsions are completely irrational because their minds are full of doubt. Delusional thinking. OCD thinking sometimes appears delusional or completely out of touch with reality. Some people who have OCD are misdiagnosed as psychotic, for example. They might get a diagnosis from a mental health professional with experience in diagnosing and treating both psychosis and OCD. Concerning extreme doubting, people with OCD, or actually people without OCD, also experience doubt as well. They demand certainty in what is an uncertain world. Uncertainty cannot be completely eliminated. The first characteristic of OCD is that when a compulsion is blocked, there is a great deal of distress. The second aspect of OCD is that it interferes with life and takes huge amounts of time that the individual is usually preoccupied with doing. OCD can feel impossible to suppress. Obsessive thought intrudes into the mind like a bolt of lightning. A compulsive action can feel as necessary as breathing. The impulse also often involves an intense feeling or a need for things to be just right. For some people, driven impulsivity underlies OCD more than actual anxiety. People who suffer from depression, for example, feel sad, have low energy states, and lack of enthusiasm. By contrast, however, OCD shows up in very different forms from person to person. Experts have struggled to come to an agreement on the various breeds of OCD, and thus uncertainty remains how to categorize OCD because so far mental health professionals have failed to reach a consensus. Unfortunately, people with OCD typically have a craving for certainty. OCD subtypes, I have listed the most common types of OCD, such as checking and doubting, contamination, inappropriate, disturbing, or shameful thoughts, superstitions, symmetry or perfection, parenting OCD, which requires you to have children, and then obsessive feelings and sensations. Each subtype or type can occur by itself or in concert with other categories. It is not unusual for OCD to morph and to evolve over time. Doubt and uncertainty plague the minds of those with the checking form of OCD. Some experts even call OCD a disease of doubt. Uncertainty always remains even after checking, so the person does it again. Doubts involve forgetting to do important tasks, or fear of making mistakes, or the need for reassurance. The first subtype or type of OCD is contamination. Obsessions about contamination plague more sufferers with OCD than any other issue, and in fact, because of COVID, it has skyrocketed. Many believe that they may become contaminated by chemicals or substances. The OCD mind greatly exaggerates real risks. People will repeatedly clean. Rituals sometimes consume much of the day. Another subtype of OCD is shame, embarrassment, and inappropriate thoughts and behaviors. This type of OCD involves a host of concerns about the possibility of doing something humiliating or inappropriate. First, there is religious obsessions and compulsions, or scrupulosity, which describes a person's excessive concern with vice and virtue, or sin and morality in a religious sense. For example, they might fear about offending a deity. The word scrupulosity comes from the Latin word scrupulus, and it means sharp stone. That's where we also get the word scrapple, but suggesting the feeling of stabbing pain that would result from acts against the conscience. People with this type of OCD have extreme concerns or dread that they will be damned and rejected. And for some, it's damned and rejected by people, some damned and rejected by a deity. Religious obsessions can come in the form of blasphemous thoughts. The person tries to neutralize or undo the feelings of intense guilt by resorting to compulsive prayers or simple rituals. The compulsions that follow religious obsessions typically do not make logical sense. A third type, sexual and aggressive obsessions and compulsions. People with this type of OCD dwell on the possibility that they might harm others or engage in sexual acts that they feel would be abhorrent and repugnant to society. Those with this type of OCD almost never do the things that they gravely fear that they will do. These people may spend hours worrying and have compulsive rituals to check the validity of their beliefs and obsessions. Other sexual obsession concerns worry that one might be a pedophiliac. All right? Those with this fear may compulsively avoid any contact with children. Unfortunately, parents can have the obsessions with their own children. Sometimes OCD in one category can easily overlap with OCD themes from another. Now we are leading to more other disturbing obsessions and compulsions that the OCD mind can create, an infinitive variety of obsessions and corresponding compulsions. A few people have endless wondering about what their purpose in life is, their teleology, I would say. This is not a typical existential crisis, but a continuous stream of unanswerable anxiety producing questions that lead to compulsive quests for reassurance. And some people can feel like they have tens of thousands of existential crises a day. Others may have obsessive thoughts and fears that what they are experiencing is not reality, that there is another world that exists out there. Theoretical physicists and theologians indeed ponder similar issues, but they are curious and undisturbed by their inquiries and speculations. Thus, they do not necessarily suffer from OCD. A fourth type, superstitions and rituals. Superstitions involve beliefs that various events, circumstances, and happenings have extraordinary significance with ominous implications. The ultimate concern of most superstitious people involves a fear of death, and thus one with superstitious OCD might attach great meaning to the power of, for example, numbers. Those with superstitious OCD may feel they must do everything in sets of 5 or some other special number. Or something horrific will occur, and they might spend lots of time worrying excessively about certain numbers. Also, anything related to death, and sometimes words. Sometimes the superstitions concern the special power and meaning of specific words. And again, since these categories of OCD are arbitrary, superstitions permeate many of the earlier categories of OCD. A fifth type is symmetry and perfectionism. A driven need for symmetry and patterns, precision as well, are common themes in an OCD category, sometimes called the just right type of OCD. Feeling compelled to order books and align things exactly, spending hours each day making sure things are lined up perfectly, rewriting notes in a perfect way every single day, multiple times. And then, of course, there's parenting OCD. When parents first take on the responsibilities when they have children, they generally feel great joy and love. Parents are also likely to feel a significant amount of fear. Parents are horrified by thoughts, but the thoughts are perfectly normal and common among new parents. They are not obsessions if the new parent dismisses the thought as a weird thought and then carries on with life. A small percentage of new parents form what's called pathological obsessions and compulsions, almost always about the fear of harming their child. It is usually referred to as perinatal OCD. A seventh type of OCD is obsessive feelings and sensations. Some people suffer from sensory motor obsessions. People with this type of disorder become overly focused on a specific aspect of functioning and believe that they are unable to change their focus. Common obsessions might include breathing, how deep, shallow, rapid, slow, or how the breath feels going in and out, swallowing, how many times, how much saliva is in the mouth, the feeling of swallowing in the mouth and throat, blinking, frequency of blinking, the feeling of the eyes when the blink occurs, and the visual changes the blink can create. Background noise, the hum of a heater, air conditioner, refrigerator, traffic noise, fan, etc. Specific noises could be the sound of a song, the clearing of a throat, sniffing, or a particular voice. Physical urges like feelings of hunger, urges to urinate or defecate, yawns. Pulse or heartbeat, listening to the sound, often occurs when attempting to fall asleep. And position in space, where one puts one's hands when sitting or standing, the feeling of sitting on a specific surface or standing in a specific posture. The obsession is being overly focused. Those with sensory motor obsessions try desperately to distract themselves from focusing on their sensations. Their compulsions therefore include the following: mental checking to see whether or not they are still aware, chanting, asking others for reassurance that they are normal, avoiding areas associated with the sensation, using substances to numb the feelings, or repeating the bothersome sensation. Separating OCD from normal worries. Are you obsessively wondering whether you have OCD? Identify yes or no to each question that follows. Each question is representative of a symptom of OCD. Studies tell us that almost everyone has occasional unwanted thoughts, which are obsessions, or engages in a few actions designed to reduce tension or distress, which are compulsions, just like the ones that I am mentioning right now. The operative words are occasional and few. Have you counted the stairs as you walk up them? I have. Have you carried a lucky charm? I have. Have you knocked on wood? I have. Have you had a horrible image of hurting someone that you care about? I have. Have you felt the need to clean your house more than usual? I have. Have you gone back to recheck the locks in your house? I typically don't because I make sure they're locked the first time. Have you had a bad feeling that you may have left the coffee pot on? Well, I haven't because I keep the coffee pot on because I love coffee. All right, wondering whether you might be gay? Yes. Avoiding stepping on cracks? Yes. Worried that your house might be burnt down? Yes. Struggle to throw out things that you don't need? Yes. Had an inappropriate, unwanted sexual image in your mind? Yes. Worried that you may have committed a sin? Yes. Worried that you may have offended someone? Yes. Had a minor physical symptom that your mind blew up into a serious illness? Yes. And felt dirty for no good reason and had a strong urge to wash your hands? No. So, those were 16 questions. More than 90% of people report occasionally experiencing some of the exact same kinds of obsessional thoughts, urges, and images that someone with OCD might have. And you've got to wonder if the other 10% are telling the truth. For example, most people have occasionally imagined physically hurting someone in a terrible way. Maybe you have walked by the knife holder in a brief, disturbing image of pulling one out and stabbing your child. You're not alone. Occasional imaginings like this are neither rare nor an indication that you have obsessive-compulsive disorder. Remember, someone with OCD frequently experiences unsettling images, truly worries about acting out those images, and feels enormously upset by them. OCD occurs around the world. It is a global phenomenon. Similar themes occur across cultures. The themes of OCD regarding fear of contamination, need for symmetry and order, worries about having inappropriate thoughts, and fear of harming oneself or others are consistently global. Specific differences, however, can be observed depending on cultural experiences. When we look at cultures, are some cultures more religious than others? Are some cultures more violent? Are some cultures more dirty and have a lack of sanitation? The United States, for example, is a very diverse nation. Diversity includes not only racial, cultural, and ethnic differences, but religious diversity, gender diversity, economic diversity, and ability/disability diversity, etc. However, there is not equal access to treatment. Some barriers to treatment include the following: cost, stigma, lack of access, language and ability differences, lack of confidence in treatment. Getting to a diagnosis of OCD. To be officially diagnosed as having OCD, I am not a doctor and I don't claim to be. I am not a mental health professional, and please do take this advice with a grain of salt and rice, and please seek help, professional psychiatrist, psychologist, or a therapist if you must need be. To be officially diagnosed as having OCD, 3 factors must be present. First, the person must frequently experience either obsessions, compulsions, or both. Second, except for children at one time or another, the person must at least partially recognize that the symptoms are illogical and unreasonable. And third, dealing with the symptoms must take up lots of time and interfere with the life of the person in a significant way. Most adults who suffer from OCD usually know at some level that their obsessions and compulsions do not make a bit of sense. Children sometimes have almost no insight or awareness that their OCD is irrational, and they sometimes think that their rituals or obsessive thoughts are quite plausible and necessary. A child may truly believe that they must repeat a certain phrase, and that if they don't say it just right, that they must keep repeating the phrase. And sometimes people with OCD even worry that they are losing their minds. As it is, OCD can take many hours of a person's time every single day. OCD interferes with jobs, relationships, school achievements, and ordinary household management. OCD takes away joy, productivity, time, and relationships while giving back worry, doubt, uncertainty, and misery. There is a warning to avoid self-diagnosis, and do not diagnose others unless you are a doctor. OCD is complex and should be evaluated by a professional who is experienced with this disorder. Avoid